Hello guys, welcome to Subu Medicine, and this is neurology. So today we'll be discussing about the descending tract. It is one of the most important motor tract that we need to go and understand clearly, okay? So whenever we talk about the descending tract, all right, which basically means is that the fibers are coming from your brain, and then it is going to your peripheral nervous system. So basically, the cell bodies for the motor neurons that are going to be in your cerebral hemisphere or in your cerebral cortex, and they're going to give out this descending fibers, and they're going to come to the actions, and they're going to find something called lower motor neurons, and that lower motor neurons is going to go and innervate your skeletal muscles. That is the bigger pictures of your descending tract. Okay, so let's talk about this. So whenever we talk about your descending tract, let's write down here, your descending tract. All right, and you guys know the tract are basically means is that there's a bundles of actions, right? Bundles of the white matters, you know, and those bundle of action, when they come together, we call them a tract, right? So descending tracts, we usually divide descending tracts into two things. One, let's divide this. One, we call them your pyramidal tract, and the other one is we call them extra pyramidal tract. And what does this mean? Which basically means is that, you know, this pyramidal tract, the pyramidal tracts are very, very important for, you know, voluntarily controlling the muscles of your, let's think of muscles of your body, all right? That's what this is. So let's write down the voluntarily, you know, you control the muscles of your body. And this is extrapyramidal, means that, you know, it is an involuntary. Let's write down here. This is involuntary, all right? Or you can say automatically you control, let's say, you know, look, for example, let's say posture, all right? Locomotion, balance. So this is this extrapyramidal tract, and which is arising from, look, a couple of things you have to understand here. This extrapyramidal tract, these guys, their cell bodies are located in here. Their cell bodies are located in a brainstem. You have to remember this, all right? And for the pyramidal, their cell bodies are usually located in here, like cerebral cortex, all right? So what is the difference between pyramidal tract and extrapyramidal tract is that pyramidal tract is the one that voluntarily that controls the muscles of your body, and your extrapyramidal tracts, their cell bodies are found in brainstems, and they do involuntarily, automatically, they control the balance, or locomotions, or postures, okay, or fine movements also. Fine movements. This has done by the extrapyramidal tract. Now, these pyramidal tracts are itself divided into further divisions. For example, you know, if a tract that is going to innervate your body, your head and neck, and we call them a corticobulbar tract. Because basically this corticobulbar tract, what it's doing is that it is bringing the information of cortex, all right, and then that is going to innervate the muscles of your head and neck area. And other one is called corticospinal tract. This is what we'll be talking about today, which is going to be the corticospinal tract, look. And that is going to focus on what? That is going to control the muscles of your body, all right? In the corticospinal tract, there are a couple of divisions. We're going to focus on the lateral corticospinal tract. Let's write down lateral corticospinal tract, and also the anterior, let's say anterior or ventral corticospinal tract. That is what we'll be focusing on, okay? So today we'll be focusing mainly on this tract, corticobulbar tract, and other tract, like for example, corticonuclear tract, we'll discuss in some other lecture. And some of this extrapyramidal tract, which are called like your rubrospinal tract, because their cell bodies are located in brain stems, all right? So all of them are descending tracts. After this like bigger concept, we have to talk about, okay? We'll talk about where do we find the cell bodies for your corticospinal tract. That's what we talk about. Remember, cortico itself tells you that means cell bodies are found in the cortex. That's what it tells you, and also at the spinal regions. We'll talk about that. All right. Now, if you see, look at this right here. So this is like you're looking for the lateral surface of the brain, right? So you know, like this area right here. Let's write down here. We'll simply say this is a frontal. All right, and then we'll make like one layer right here. We'll just make this as a one layer, and let's make this as a central sulcus, because this central sulcus divides your frontal and parietal lobe, and then we'll down right here. This part right here down here, like we'll say occipital lobe, right? Occipital lobe right here, and this is going to be a temporal lobe. What has to the hearing and all that. And then this is going to be a parietal lobe, right? Parietal lobe. So mainly, we have to talk about where do we find the motor neurons for this corticospinal tract, right? So if you look at the brain right here, in the frontal lobe, if we divide frontal lobe into two, we should always divide frontal lobe into two parts. Motor cortex, and other one is called prefrontal cortex, all right? So let's divide this. Frontal and then prefrontal cortex. So basically, anterior to the central sulcus, you're going to find this, because brain is very convoluted, and it has a lot of this gyri and sulci, all right? Because of that. And then if we just make the anterior to this central sulcus, you're going to see this big guy right here, okay? And this guy right here, this is called, we'll just write down here, primary motor cortex. All right, and then anterior to the primary motor cortex, like around like down here, okay, because remember, this primary motor cortex is located within the precentral gyri. Let's write down here. This is called, let's say, precentral gyri. All right, and then anterior to the precentral gyri, you're going to find the cell bodies around, let's say, this one right here. And this is called, let me write down here. There's a lot of cell bodies you're going to find here. This is called, okay, let me write down here, premotor cortex. And then, like right here, around here, there's also going to be something called superior frontal gyri. In the superior frontal gyri, the medial surface of the superior frontal gyri, you're going to find something else called here. Let's just write down here. Nuclei for this motor cortex, which is called, let me write down, supplementary motor cortex. Look, this is very important. So basically, in your frontal lobe, all right, I'm dividing into two regions, motor cortex regions, and then other one is a prefrontal cortex regions, right? So this motor cortex regions contains what? Primary motor cortex, it contains premotor cortex, and also it contains supplementary motor cortex, okay? All together, we call them a motor cortex. And then down here, there's going to be like around here, this is going to be, let's say we can divide this, we're going to call them a middle frontal gyri. And there's also going to be here inferior frontal gyri, okay? So basically, and then all the rest of the part is what's called prefrontal cortex, all right? Now, what is the importance of this middle frontal gyri? Let me just quickly touch on that. I'm not going to go super detailed about it. This middle frontal gyri, they contain something called frontal eye field, all right? So, if some reasons, let's say if you irritate the middle frontal gyri, because they contain middle eye field, and some of the conditions that could irritate would be something like, let's say, epileptic seizures, that can actually irritate this middle frontal eye field. And if that happens, that seizure will cause, your vision to look contralateral to the lesions, all right? But if some regions, let's say there's a stroke, for instance, let's say middle cerebral artery stroke, all right? If that happens, or because of that, there's a destruction of the middle eye field. That means if there's a destruction, that means there will be no cell bodies there. So because of that, it's complete destruction of the middle eye field that will cause the patient to have, lesion ipsilateral to the lesion. Okay, ipsilateral to the lesion. And this is something that I want to quickly touch on that, all right? Now after that, and this inferior frontal gyra is the one, that contains cell bodies for like Broca's areas. And that is for what? Speech, right? I'm not going to focus too much into that, but I'm just quickly emphasizing on that, right? And look, because our primary focus is the motor cortex right here. Now look, this primary motor cortex is the one that contains, this is an output system. Let's just write down here. Because these guys have let's just write down here. These guys have like all this coming down here like this. This is output systems, and their actions are heavily myelinated, all right? And what is the premotor cortex? What is the functions of the premotor cortex? Premotor cortex is sort of like, it's like a program. It programs, or it executes what exactly, what exactly you're supposed to do. So this premotor cortex is the one that coordinates the functions of the primary motor cortex. Like for instance, let me give you an example. Like for example, how do I know that I should use this black marker or I should use this, let's say, this blue marker? Okay, this is being programmed by my premotor cortex, all right? So that is one of the functions of the premotor cortex. And the supplementary motor cortex, what it does is that it's sort of like, it controls, let's say, learned response. Like if you need to throw the ball, all right? Or also, it also, controls your axial muscles or your larger muscles, like trunk muscles. That is the functions of the supplementary motor cortex. And this premotor cortex, again, it programs the primary cortex to execute your voluntary movements of your body, all right? Because it can tell how to give like refined or fine movements, all right? So, as I said, and this primary motor cortex is the one that's output system, all right? Because all these actions are going to come from the primary motor cortex, all right? Now, I have to talk about, there's one type of cells that you found here in the primary cortex. And guys, just quickly letting you guys know, this primary cortex are divided into different layers. They're also called neocortex, right? Because one is like, let me just quickly talk about this. One is called molecular layer, first one. All right, second one, they call this as you can say external granular layer. And like third is like external, let's say, pyramidal layer. And fourth is, let's say, internal, like the internal granular layer. And fifth is, let's say, internal pyramidal layer. All right? And then there's also number 6. But I want you to remember this one. This fifth one, which is the internal pyramidal layer, this is the one, this is called internal pyramidal layer. This is the one that contains cell bodies for the upper motor neurons. All right? So, because this is the one that gives rise to corticospinal tract, corticobulbar tract, corticonuclear tract. All right? So this internal pyramidal layer, they're the one that contains cell bodies for that. And this you see this internal granular layer, they receive like sensory information from like your ventroposterolateral of your thalami. Okay? But remember, this internal pyramidal layer is the one that gives rise to this corticospinal tract, corticobulbar tract. All right? Now, also one more thing that I do have to talk about this is that this internal pyramidal layer, they also contain these cells. These are called pyramidal cells or bats. Let me write down here. What are they called? It's called pyramidal cells of bats. Look, beat like this. This bats, it came from this Ukraine scientist. His name is Vladimir Blatz, okay? And what is the VADS? That's what it is. So what is the importance of VADS is that these are one of those largest diameter size of neurons that are found in here in the primary motor cortex. And their velocities or the diameter is almost like 100 micrometers, because they can send, and their actions are also very, very heavily myelinated. When the actions of fibers come from the pyramidal cells of bats, what happens is that they go directly to the spinal cord and they'll synapse at the anterior horn of the spinal cord. That's what these guys do. They're very, very fast when it comes about their velocity. All right? So this is something that I wanted to quickly emphasize on that. All right? Now, after this, we also have to talk about, what is this called? This is a parietal, right? Here, this is a one more layer cells you get to see, which is called, let's say this one. This is called post-central xyri. And these contain what somatosensory motor information, right? Contains somatosensory motor information. So whenever we have to voluntarily move our body, the fibers have to, all of them, like for example, all of them usually they come together, right, and give like these actions, give this, the motor fibers, which is going to come down, which is going to descend downward and go to the spinal cord, all right? So look, now if I have to quickly write it down here, let's write it down here. Or should I write it down? Let me erase this. So, let's say this is my brain right here, right? Let's say these guys have all these neurons right here. And it is coming downwards like this. You see this is, okay, let me make this in a very simple language. Actually, let's just say this is one of my cell bodies, motor neurons. It is coming down and synapsing, okay? And then there's also one more guy here, synapsing at this area and gives signals and goes to the, let's say, skeletal muscles. Look, like this is, let's say this is a neuron that is coming from your, that's a cerebral cortex, and it is synapsing at the spinal cord. This up to this part we call them a upper, let's say upper motor neuron. And then from this is the spinal cord right here. It relays signal to the spinal cord of the anterior horn of the spinal cord, and then from there, the actions will go and then innervate the skeletal muscles. This is called your lower motor neuron. Or simply you can say this is a LMN, and this one you say UPN. All right? This is just a bigger picture that I'm trying to tell you. All right? Now, after this, let's talk about in more depth about how this corticospinal tract plays a role. All right? If we want to make movements, how do we send fibers that's to our hand, let's say, or my distal, my fingers, if I want to move my fingers, how do I do that? What is the process? That's what we discuss about. Now, before we go depth about it, let's discuss about, like just a bigger pictures, and then we'll go so detail about it. All right? So let's just talk about it. So you see, like this is you can simply say this is a brain right here, okay? And this is the right side of the brain, this is the left side of the brain, all right? And this is going to be your brain stem, which is going to be your, your midbrains, your pons, and your medulla. And this is, let's say this is my spinal cord, and these are my skeletal muscles. So what is going to happen here is that, like let's say the fibers from here, it's going to come down here, basically from the right side of the brain. Let's say if I want to move my, let's say left side of the hand, then what is going to happen is that somehow my premotor cortex has to coordinate, or all of those coordinate my primary motor cortex, right? And also look, not only that, all the time what is also happening is that, all this primary motor cortex, right? Supplementary motor cortex, or premotor cortex, all of them are continuously, they're upgrading by your cerebellum, okay? Because they're always, the fibers are going from the cerebellum to the brain, because your cerebellum knows unconsciously what you're doing too. All right. So all the time they're also upgrading this. Your cerebral cortex gets upgraded by your cerebellum. But now let's look at the bigger picture. So let's say if I want to move my left side of my hand, if I want to do that, what is going to happen? Like your brain, what they do is, like from here, like cell bodies from you, let's say your right side of your brain, it's going to come down like this. It's going to go all the way down right here like this, all right? All the way down right here. And look at the brainstem right here. At the brainstem, at the medulla, or at the junctions of, let's say, medulla spinal junctions, all right? What happens is it's going to decussate like this. You see? So look, from the right side of the brain, the fibers comes down here, and this is the upper motor neurons, right? And then at here, let's say in the medulla, this is going to call as a, it's going to get decussated, meaning it's going to cross over. What do we call that? We call them, you can simply say, pyramidal decussations happen at the medulla regions. And what is the region? What do we call that? We can simply call this as a, let's say, medulla spinal junctions. Okay, so this is where, let's say, these guys crossover happen, and from there, the fibers of this upper motor neuron, still it's upper motor, it's going to keep coming down right here. All right, it's going to keep coming down here, right? And then what's going to happen? Then it's going to go to the spinal cord. Let's say this is, as I said, this is spinal cord, right? And go to spinal cord, and here is going to what? It's going to synapse at the anterior horn of the spinal cord, because they're the one, they're because those anterior horn of the spinal cord, like right here, these are anterior horn, right? These are ventral horn. They're the one that contains like those alpha or motor, those neurons. And those are the lower motor neurons to innervate your skeletal muscles, right? So let's say they come down here, and then they will do what? They'll synapse at this lower motor neurons, and then from there, their output goes like here, like this. All right? Like this. And now, all the way down here, look, all the way. This is called my, look, upper motor neurons. And like down here, look, this one, we call them a lower motor neuron. Look what happened here. So this is how, okay? And let's say this is my, as I said, this is my left side of my, let's say, left side of the, let's say, hand that I wanted to move. Just like that, let's say if I want to move my right side of the hand, same thing gonna happen right here. The left side of the brain, right? Let's say this is gonna happen right here. It's gonna come all the way down here like this, and then it's going to decussate like this, and I'm gonna come down, and relay. This signals is gonna synapse here at the, there's the lower motor neurons right here. This is lower motor neurons, and that's going to innervate right here. Look at this. And this is how it works. So this is the bigger pictures. This is a bigger picture. All right. Now we have to look at this, and then we have to go a lot more detail about how this is going to work. All right. So look, this is my brain, right? Cortex. So let's go in very detail about how this is going to work. So their cell bodies are located in where? As I said, in the cortex regions. We already talked about the supplementary motor cortex, like premotor cortex, all of them, right? So from here, what is going to happen right here is that, let's say, what is it? We said this is the right side. Let's say this is my right side. And we said this is the left side, right? The cell bodies from here, all the way down from here, it's going to come down. It's going to like go everywhere. And remember, you don't forget these big cells too. These big cells are what? Big cells are bat cells, right? All the way going to come down here, and it's going to kind of like, look, it is kind of like fanning out. And this fanning out is called corona radiata, okay? They're fanning out from all the way, place from this way, and fanning out. And you know what's going to go? Look at this. You guys know this, like these are thalamus, right? And the thalamus, thalamus is there, in between the thalamus, there is going to be a ventricular system. And then, look at this, what is this called? This is a posterior limb of the internal capsule, okay? Sorry, this is a whole structure called internal capsule. And this area right here, like this part right here, this area right here, we call them a posterior limb, right? And then obviously you're going to have lateral to this, you're going to have, globus pallidus and globus pallidus. But I didn't draw that, but just know that there's going to be also globus pallidus. All of them, okay, because they're all are radiating, right? And they're going to come actually, come together because they have to pass this very narrow area in order to come down. And this is a very, very narrow area because in the cortex, because cell bodies are scattered and they're giving fibers, right? So there are scattered fibers you get to see. But then when they're coming down, what is going to happen is that they have to pass through this posterior limb of internal capsule. So what is that? They all come together, merge together, okay? So when they come merge together, they have to pass a very, very small, narrow area like here, like this, right? And this is very, very important because remember, sometimes, there could be something called capsular stroke. That could happen, let's say, for instance, people have those chronic hypertension, there's uncontrolled hypertension, or even diabetic mellitus, or there is, let's say, a stroke happen, and that stroke ruptured this blood supply that actually supplies this posterior limb of the internal capsule, which is called lenticulostriate artery. It's very important. Let me write it down here. What should I write down here? Okay, let me just write it down here. It is called lenticulostriate arteries. It is a branch of middle cerebral artery. So it's a very, very small branches. So what is going to happen is if there's a damage of this lenticulostriate artery, then what is going to happen? That could give something called capsular stroke. Okay, so that can give problems to the patient. Usually this also happens in old age also. All right, and that problem is something called hemiplegia. All right, now after that, what is going to happen? This fibers is going to come down, all right, from the posterior limb of the internal capsules, and then it's going to go down, go down, go down like this. It's going to come down like this, and then it started coming down. It's like again fanning out like this, all right, and then it's going to go to what is this called? This is called your midbrain. Same thing is going to happen on the left side of the brain too. Let's make this as here. All this cortex right here. Repetitive is good. All right, so let's understand this. Same thing right here. It's going to come down here. I'm going to go to this posterior limb right here. And this is called what? Coronary radiator, right? Come down here, bundles. And then it's going to start fanning out like this. All right? And then this is going to go to the midbrain. All right? Look, fibers are coming out, passing to the posterior limb of the internal capsules and coming down. And as they come down in the midbrain, the brainstem we're hitting, right? And what is that? They start fanning out. And they're going to go specifically to the brain. But why we have to talk? Now come back here for that one. Look, this is a midbrain, all right? So let's just talk midbrain. If I say this is a midbrain, and you guys know this is a cerebral aqueduct, right? And here, this is, let's write down here, cerebral aqueduct, and then also there is going to be a periaqueduct gray also, that is for the pain. Look, what is the importance here is that, this is a midbrain where you're going to find this black structure right here, which is called substance nigra and all. All right? But the most importantly, I want to focus here is that, not on the substance nigra, but as these fibers are coming down, there's going to be this special part here. Usually your midbrains are divided into three parts. This area right here, which is the posterior side, we call them a tactile area, okay, because they are the one that contain the supracolliculi or inferior colliculi for your hearing and vision. And then this middle part, we call them a tegmentum, right? And this is the base part right here. Okay, this is a base part. Because in this is a base part, what they have? They have this structure right here. Let me use a different color. They have this structure right here. This part right here. This structure right here. This structure is called, very, very important, it's called crus cerebri. Because when the fibers are coming down here, it's going to pass through the crus cerebri. And then when the fiber passes through this crus cerebri, the fibers, we call them up. When they're passing this together, the bundles of fibers, we call them up. Let me write down here. Let's say cerebral peduncle. This is called cerebral peduncle, okay? Those fibers together when they pass, and they pass like immediately about like, let's say this is like, passes like, let's say, let me make it in red actually, because we've been using red. Now the fibers come, let's say, from your brain, and then the fiber passes like this. Like this. Same thing here. Fibers are passing through this. And when this fiber passes, where are they going to go? They're going to go to the pons right here. And when they go to the pons, guys, you know where they go? They go, and then they're going to go to this nuclei on the pons area right here. What is this nuclei called? This is called pontine nuclei. This is called, what is this called? The pontine nuclei right here. Because these guys are going to go past the crus cerebri, right? And these together we call them cerebral peduncle, and then they're going to go and they're going to actually, synapse to this guy right here, to this pontine nuclei. Like we'll show it over here too. It's going to go past the crus cerebri right here, okay? And then this cerebral peduncle, and then I'm going to go, look, collateral, they give this collateral signal to this pontine nuclei. And you know what the pontine nuclei do? The way it works is very, very funny. Like this pontine nuclei, they give like a fibers, like look, fibers like this. It's from, look, the left side of this, the pontine nuclei, this come, and then goes to this, what is this space called? This is called middle, this cerebellum peduncle. Okay, middle cerebral peduncle go and then update the information to, what is this guy? They all update the information to, and here, let's just make this as, let's update this information to your cerebellum like this. So this is how the cerebellums are continuously like updated about what's going on, right? So again, the fibers from the brain, as they come down, they pass to the posterior limb of the internal capsule. They pass to the midbrain, the 3/5 actually part of this area, which is called crus cerebri of the cerebral peduncle, which is on the base area. So this is called base, all right? It passes, and then some of the fibers, they go, and they go and they give signals, or they synapse at this nuclei, which is called pontine nuclei. And do you know what is the difference? Why do we call them nuclei? The reason why we call them nuclei is because because these guys are present within the white matter. Because these guys these bodies are within the white matters, that's why we call them nuclei. All right? So, and after that, what is going to happen is this pontine nuclei, with their actions, they're going to what? They're going to go and update this pontine nuclei. Then after, what is going to happen? They're going to go, and then what is going to happen? They will upgrade the information to the contralateral side. That through this middle cerebellum peduncle. Okay? Now, after this, what is going to happen here is that this fiber, this is how your cerebellum always know what is going on. They're always upgraded, all right? Now, then what is going to happen is these fibers will keep coming down, look, like this, coming down right here, because they were a little scattered over there. They were a little scattered, it's coming down here, fibers, and they're going to go to, what is this called? This area, which is the medulla. So here, right here, so they come down here, and then they synapse it, and then this guy come down here, let's just come down here like this, and they go to this area. What is this called? This is gonna be my medulla. So you see, this is my medulla picture, right? So when it comes to medulla, look at what is this called? These two areas we call them, let's say these are pyramid, and in pons, this is going to be your pyramid, right? So here, when they come here, what is going to happen is that, the pyramid was there before, and I hope it's still there. When they come down here, what is going to happen is that, they sort of like a decussage from here like this. This is where the decussation happens. Basically, this is how they decussage. Look at this. So, the reason why we call them the pyramidal tract is also because these white bundles that are coming down here, these actions, what they do is that they make this pyramid down here, all right? Because they make all this pyramid right here. There's a lot of fibers out there. They make a lot of this pyramid, all right? And this pyramid, what happens is that they decussage like this. They decussage. That's the reason why we also call them a pyramidal tract. So basically, at the lower medullary regions, this corticospinal tract, all right, they decussage, meaning the crossover happens. The crossing over happens. Crossing over, or we call them, let's say, decussations happens at these regions.